Coach, we're going to start at this point for the final session. I have to say, to have a chance to speak to any of these women individually would be a treat, and have them all in the same room at the same time sharing. This is a very rare occasion. I can say very much with confidence throughout the pandemic and onwards, I'm very fortunate to work with many of them, and the tireless work that they've done for schools, for systems, for the betterment of students. It can't go unnoticed, and that's really the spirit of how we create today, to be honest. So we're going to have a chance to focus on the many different systems at work, at play, that could support our students. Each of the speakers, I believe, will be introducing themselves as they come up, providing a little bit of background as far as the work that they do and expanding from there. But with that being said, I'm going to turn it over to the Dr. Stacie Molnar-Main.
All right. Well, welcome everyone. I got to sit in some of the presentations. What a great event. This is wonderful. I'm a former school psychologist and school counselor. I worked elementary, middle school. So I feel like it's coming home day. And so I'm so happy to be here. Right now, I'm working as a consultant to the Office for Safe Schools, where my focus is on school climate, MTSS, and social emotional wellness. I work with Dana Malakovic, who many of you know, who's our mental health and trauma specialist. And so I'm very fortunate to have great mentorship from a colleague there. So I'm just going to get us started, and then I'm going to pass it off to my colleagues so you understand where we're coming from, who we are. We each are going to give you a takeaway or two that, in case we don't get to them in our Q&A, and then we're going to turn it over to Q&A. So I'm with the Pennsylvania Department of Education's Office for Safe Schools. This is really the office that for years and years has been an intersection point around student mental health, because we have been partners with the Department of Health around the Student Assistance Program. And we're developing a more pointed focus on student mental health and wellness as a way of thinking about school safety and the comprehensive needs that underlie a safe system for kids, as well as an early identification system. The key messages that I just would like for you to take away from PDE's perspective is that the way we're defining mental health is that it includes reaching developmental and emotional milestones, as well as learning healthy social skills and how to cope when there are problems. We're just defining it that simply. That we think staff mental health and social emotional wellness is on par in importance to student mental health and social emotional wellness, because you can't be there to take care of kids if you're not healthy yourselves. And I know that, that's a cliche, but we recognize through the pandemic how much the stress on our workforce affects our kids, or affects our ability to show up for our kids in the ways that they need it. So when we talk about MTSS systems, we are also talking about staff needs. And then finally, we believe that youth mental health is supported by equitable, trauma-informed school systems that promote healthy, supportive relationships and tiered approaches to social emotional wellness and learning. So the big ideas, equity and trauma, are integrated through everything, that we support an MTSS or tiered system of support, and that relationships are key throughout that. That's adult-adult relationships, student-to-student relationships, student-adult relationships, our relationships with parents, families, etc. Resources that I wanted you to be aware of are just our webpage around mental health supports, because those are where PDE is constantly putting out the things that we hope that you will align to. There's a language document called Empowerment Through a Common Language. This is trauma-informed language for schools. We know that if we have a common language, we can then begin to work on things. So I wanted you to be aware of that, as well as the Equitable Practices Hub and the Safe Schools Targeted Grants. This year, although we are past our deadline, we increased the grant amount to $50,000. Our program and equipment grants are combined this year. So in the past, you could only apply for $20,000 for programs or equipment. You can apply for up to $50,000 now, and our SRO and SPO grants are still available too.
All right, good afternoon. My name is Brandy Fox. I work for the Pennsylvania Key. The Pennsylvania Key is a business partner of the Office of Child Development and Early Learning. So OCDEL, as we call it, does everything around early childhood services, early intervention, quality child care. They support state-funded Head Start and other services to Head Start and our state-funded pre-K, but we also have what's called an infant early childhood mental health consultation project. So I have a team of 31 that can go into childcare programs and support the birth to 5 population alongside their caregivers to support their social emotional development, AKA their mental health. I also wear a couple other hats. As you can see, I'm the board president of our Pennsylvania Association for Infant Mental Health and also the Alliance for the Advancement of Infant Mental Health, which is an international organization that supports all the state aims, as we call them, around workforce development in infant early childhood mental health informed practices, clinical services, just all the things that we try to do to try to focus and hone in on our babies so that when they come to K-12, they're healthier, they have the soft skills that they need in order to succeed. So a couple of things I would just want to leave with you is, just as their physical health is important, so is their mental health, and that does start prenatally. All the way through our lifespan, and that it's the relationships that actually help to create a young child's mental health or healthy start. The interactions that we have that serve and return with babies. I don't know if anyone in here looks at those toddlers that are in Target carts with their moms and smiles and tries to get them to connect back. All of those things actually build their brain pathways and help them create a strong foundation for their life. So you said relationships are really important. So in infant mental health, we say that the relationships are the intervention, the relationship between that child and that parent, between that parent and a community member, between our systems partners, they are the first line of intervention. So I would be remiss if I didn't share a video about babies. So let's see if it works.
I see you. I see you. I feel your love. I hear your comments. I love who you are. I look forward to who you will be. You are my daughter, my son, my niece, my grandson. You are mine. I see you. I hear your voice. I love you so much. I'm you are my father, my auntie.
Sorry about that.
Stop that.
I'm trying to get to the next page. Okay.
School-based mental health professionals, we don't like our feelings.
So I share that just because everything we try to do in Octel is to support those connections, whether that is between the parent and the child or the family and the child through home visiting or early intervention, whether that is through the child and the child care educator in those classrooms that they may spend 8 hours in. So all of the things that we're trying to do in Octel is to create those strong connections so that those munchkins are ready to be a part of your communities when they go. And hopefully there's some transition and some supportive warm handoffs from the childcare setting to K-12 so that that's a nice kind of bridge. So partner with so part of this is like, think about those kids that have younger siblings at home. How are we connecting with those families? How are we connecting them to Octel services in your community? Whether that's quality childcare, whether that's an early learning resource center that can kind of get them connected to subsidy if that's needed, whether that's early intervention. So maybe find out who your feeder programs are in your community and connect with them and create that bridge. You know, if you know that there's a family that's struggling and has a younger child in a childcare program, my consultation project probably could go in and help that childcare program support that child. So feel free to connect them to us. So just wanted to let you know that there are some great early childhood services in your communities to think about connecting families to.
Do you offer those services also in like K-4 programs that are within districts?
Yes, so we do serve like pre-K counts programs and school age childcare. If they're before and after school, I just added a school age mental health consultant. So we have services. If you want to connect with me, I can share where to get hold of that. Okay. And I have a list of resources that I think are going to be on a Padlet too that you can take a look at. Okay.
Thank you, Brandy.
You're welcome.
And if you give me the link to that video, I can put it on. Okay. All right. I'm Dr. Chanda Telleen, and I am from PATTAN, the Pennsylvania Training and Technical Assistance Network. And you can say PATTAN or PATTAN. I know people always ask me which is correct. They both are. We hear it both ways. And so our mission and our goal. So whenever I present, I have to say our mission. And so the mission of PATTAN is to support the efforts and initiatives of the Bureau of Special Education and to build the capacity of local education agencies to serve students who receive special education services. And our goal is to consider the LRE before we consider a more restrictive environment. So some of the key messages have already been spoken about, and I love how Brandy put that. So our goal really is simple, is that good mental health is important for everyone. And just like Stacie said, everyone means everyone, whether that's students, staff, caregivers. We think about all those vested partners, and we want to think about everyone's mental health. And we do believe that mental health is just as important as physical health for quality of life. And we think about mental health, including having those important skills for coping with life challenges. As Stacie put it, we think about trauma, we think about equity, we think about making sure that everyone belongs. And that is an important part of mental health. And thinking about school counselors, we know that they can work independently as well as collaboratively with school mental health professionals to ensure that all students have the support that they need to be successful. And as far as my background, I am a school mental health professional. My background is as a school psych, just like Stacie. My role at PATTAN is that I support our learning environment and engagement initiative. I'm also on our school psychology initiative, and I'm also part of our equity initiative at PATTAN and serve as the statewide lead for both equity and learning environment and engagement. We just had our implementers forum last week. Were any of you there by chance? Hey, forum participants, wonderful. If you weren't there this year, I hope that you can be there next year, where we will be having an integrated forum with our MTSS academic, as well as our folks who support behavior. So when I was thinking about resources, if you think about two of the initiatives I support, learning environment and engagement, as well as our school psych initiative, I feel like those both align with the important work that you do, specifically thinking about prevention and wellness promotion through a multi-tiered system of support. And, you know, we hear MTSS being applied to everything, and that's because it can be applied to everything. Thinking about positive behavior interventions and supports, thinking about positive classroom behavior supports, that's a passion of mine. Thinking about de-escalation strategies, and we are offering sessions in the new year, which is how many weeks away? So in February and March, and in the spring, we'll be offering sessions around de-escalation strategies. We'll be offering sessions around what we used to call classroom management, but we like to rebrand that into positive classroom behavior supports. And we're going to have sessions focused for administrators to create a system, and also for staff members to put those strategies and practices into place. With our school psych initiative, we offer psychological counseling as a related service. We had a Schoology course last year, and now we have like our videos from that and our patent publications. We also offer Prepare for mental health interveners, of which Scott, Mr. Sharp, Dr. Sharp, Mr. Sharp,
That
was-
guy, I get that guy.
that guy over in the corner, just did our workshop too, which he will tell you was excellent.
It was excellent, it was amazing.
It was amazing. It was an amazing 2 days. So if you have an opportunity to be a part of Prepare Workshop 2 or Workshop 1, please be involved with that. We also have work on creating comprehensive school-based mental health and behavioral health services. So having our school psychs, our school counselors working together, also working with our social workers to create a full continuum of responses. And so we did create, or I should say, I created a Padlet and told these ladies that I would be putting their resources on there without their knowledge. So I hope that's okay. What does it say? It's not found. Hold on. It's because it's a bit.ly link. See if I can go back. I'm going to log into it and I will put the correct Padlet link up there. And now I can't get back to our PowerPoint.
It's still up there.
It's still up there? Okay, it's just me that's seeing the Padlet link. So this is the link to our Padlet, and it has all of the resources that everyone is showing you. So all the links that you see up here on the PowerPoints are going to be on the Padlet, and I will make sure that this bit.ly link is working before I leave here today. Okay, all right, and so I will turn this over to our next panelist. But they can't see it here, so I'm not sure how to flip back.
Thank you.
It was just. It was just.
Lauren, Kyle.
You exit full screen.
Yeah, can we? And then I just saw it.
This is for the people at home.
There we go. There we go.
Ta-da.
Okay. Okay. And then you just want to go down.
Want to share it again.
Okay, right here.
The hybrid world that we've entered. It's great that we can do it though, right? It just takes a little more. We need those brain chips so we can think what we want our computers to do.
Screen sharing, and we're gonna do the PowerPoint.
You are all doing so well.
I'm walking away before I break it.
Perfect. Great. Okay. And that's where.
All right, Brittany, your turn.
Yes.
Yeah, we think. I think we did it. We think it's fixed.
Good afternoon. My name is Brittany Lourea-Waddell, and I'm here representing the Pennsylvania Association of Intermediate Units. I work at Montgomery County Intermediate Unit, IU 23. We have about 29 different intermediate units that come together to provide services and supports for students, as well as to support school districts. And specifically, we work with behavioral, emotional, and mental health needs of students. Recently, about a few years ago, we formed a mental health job-alike group to focus more specifically on navigating the mental health needs of students. So some key takeaways. I focus here on suicide prevention because that's like I'm a certified school psychologist and licensed psychologist, so it's my passion. I love that stuff. Not that I love preventing whatever we can prevent mental health wise. Sorry, my phone's ringing. So key takeaways. School counselors can play an important role in the recognition of the signs and symptoms of depression, as well as suicidal ideation. It's really important. I know that you guys hear it all the time, but the kids in our schools that get the most attention tend to be the ones that are more the externalizers. So really important to focus on those kiddos. And we're seeing it now at very young ages. Like you would think before it was like middle school, high school. Now we're seeing it, the babies, like the elementary, the kindergartners, the first graders. So some of the signs to look for, just like look for, and you guys all know these things, but like the withdrawal behavior, like not participating in activities that they were happy that they were participating in before. And really just doing those screeners if you can. If you guys are doing screeners in your school and you're set up to do that, to have someone who's there monitoring the screeners so that you can determine if there's risk. And then really important, and I'm gonna I feel like I say this all the time, is just making sure that you're properly trained in doing suicide risk assessments. It's huge. But it doesn't end there, because I think that I think people think, well, once they're trained in suicide risk assessment, well, then, if they're not, if they're only a mild risk or whatever, then you can just kind of let them. There's so much involved with it. It's really like having that warm handoff. They might need another level of care. They might need outpatient therapy. They might need to go to a crisis center. They might need to go to an inpatient facility. So it's making sure you have a list of providers in your area, resources that you can share with families to get the students the support that they need in a timely fashion. So I just think a lot of times in districts, I see a lot of referrals out to crisis, have crisis come in and do it. And you guys are all trained. You guys are all or you're all experts in your field. So it'd be great to build the capacity within our districts to have our counselors, our psychologists and social workers to do that, so that we can work so closely with those providers and make sure that the kids get the support that they need. As far as resources go, PDE has the accelerated learning toolkit. So you can work as a school district, you can work with your intermediate units to provide a supportive learning environment using the accelerated learning toolkit. If you go to preventsuicidepa.org, there's resources. There's also trainings that you can do for suicide prevention. And then the kind of like the hallmark, the suicide risk assessment that we recommend, that we've used across the state and a lot of our different intermediate units, is the Columbia. I'm not sure if you guys are familiar with that, but the Columbia suicide risk assessment is actually a really good risk assessment to use. But like I said, the risk assessment is good, but then what you do with that data is even way more important, making sure that the students get the help that they need as quickly as they can. So, yeah. Nice to meet everybody.
Okay, good afternoon. My name is Perry Rosen. I am also a school psychologist. I feel like we're kind of taking over the panel a little bit. And I work at the Department of Human Services, the Office of Mental Health and Substance Abuse Services in Harrisburg. I work in the Children's Bureau under OMSA, so we focus on a lot of different types of things around the mental health service system. Our office has worked on the development and promulgation of regulations such as for IBHS, which replaced VHRS. We're looking at grants related to our crisis system. So for example, a lot of you are familiar that we have 988 as our 3-digit national crisis line now. And so every state, including Pennsylvania, through our office, has received grants to look at the implementation and rollout of 988. And in fact, I think a lot of our initiatives are grant-based, but we also do a lot of collaboration with our other state agency partners, PDE and DDAP, such as around things like the Student Assistance Program, which is also a really big part of my role. And a lot of the focus of our efforts is on ensuring family voice and choice, as well as youth voice in their mental health care and needs. And so the things that I really want to focus on, a lot of my role, kind of similar to what Brittany shared, has been on our youth suicide prevention grants. So I spent a lot of time looking at suicide prevention in school. Also, as I mentioned, a lot of work through the Student Assistance Program, and really thinking about mental health supports in schools from a multi-tiered lens, as a lot of our panelists have already talked about. But obviously, we know that mental health needs are increasing, and schools are the main context and setting in which any kind of treatment or support services are received by kids that need them. We know most kids that need treatment and supports don't get them, and the ones that do, most of them get them in the schools. And I know you all know this very well, but that's the formalized treatment, right? And so we license services like outpatient, IBHS, partial hospitalizations. We've seen an increase in the number of schools that are offering these services in-house, but that also includes a lot of the non-treatment supports and services that we'd offer along that continuum, and a lot of the things that you are all doing each and every day. So even though we're not necessarily considering that formalized mental health treatment, that is a huge, huge part of this continuum. And so really, I just kind of want to underscore that continuum of supports. And we're doing a lot of these things, but we're not always thinking about them in the context of that infrastructure so that we can sustain the things we're doing. And so I think because we get so bogged down and overburdened in our schools, a lot of times it's like, okay, there's a mandate for this, quick, do that. You know, we have to do this training, do that. And I think a lot of what we try to talk about is how does that align with our policies and procedures? How do we situate that within our continuum so we can do these things with intentionality? What data are we gathering about the different initiatives that we have? And how can we really use that to inform our prevention needs? So again, I just really echo the statements about fitting mental health under the same framework. And when it comes to suicide prevention, thinking about it the same way, and all the things that we're doing universally, right? All of our climate initiatives, our bullying prevention efforts, our trauma-informed practices, we see those as supporting our suicide prevention efforts, really preventing some of the worst possible outcomes that we're really trying to work towards in our schools. And I think the other thing I really just want to underscore is that schools don't have to do this alone. They shouldn't do this work alone, right? And Representative Schlossberg made the comment that mental health is not just the mental health system. It's so much more. Schools have a very, very critical role to play in this work, but they can also look to their many partners in how to do this better, including their SAP liaisons, right? So using the SAP system, using, you know, I know that SAP isn't always functioning well in every setting, right? But relying on our teams, and you as school counselors, a lot of the work often falls on you. Sometimes you're working kind of single-handedly and in isolation to do it, but one of the benefits of working in schools is that there's other people there, and really thinking about the teams that can support our efforts so that we can have a bigger impact. And that's so that we keep all of you in the field and don't, you know, burn each other out, right? So I think these are some of the big considerations, and there's a lot of work going on in terms of trying to build up that cross-systems collaboration so that we can be more effective in this work. Some of the resources I want to highlight, and I have quite a few. Obviously, there are some crisis resources along the bottom there, and I know you are all instrumental in really pushing out and advocating these resources, but not just that, helping students understand what these resources can do for them, right? So passing along 988, but talking to students about what that is, what they can expect when they make those calls, helping them to make those calls, doing all those kinds of things. There are links here for your county mental health and developmental services contacts, which are really your go-to in the county for asking any kinds of questions about mental health services that may be available locally. And being a Commonwealth, it's so hard to give a broad brush on services in Pennsylvania because so much comes down to the local level. So that really would be your first go-to for any kind of question or concern there. If you are looking to know more about 988, we have a whole team working on that. And it's not just about the implementation and rollout of this new number, but we really are taking a look at our entire crisis service system and really thinking about how we can expand and have more of a continuum of crisis supports and services, because we know what those pathways typically are right now and the outcomes we typically get from them, and realize there's a need to expand even within these other systems. A couple other things I just want to mention. So knowing that outpatient services delivered in school settings is something that a lot of schools have been looking at, and that service has been increasing within schools. It raises a lot of questions, of course, just how does this interface with our teams? What are the different laws and regulations? So many questions have come up, and I worked with PDE and DDAP to create this guidance document. So if you are working with outpatient providers in your school, there's a lot of great considerations in there for having some collaborative conversations and trying to get ahead of some of the pitfalls and challenges that sometimes do arise that we don't necessarily even think of right before they come up. Another thing I want to just quickly mention, so the practical guidance for exploring the integration and alignment of SAP and MTSS, I think a lot of the conversations at the state level across agencies are around helping schools think about aligning their efforts, right? We don't want to continue to burden schools with one more thing to do. So we're trying to really encourage a lot of these initiatives, a lot of these programs have similar goals. How can we weave them together so that we're not sitting in different meetings talking about the same student and having all of that duplication when time and resources are precious in our schools. And then a final thing I'll just make a quick plug for. So Brittany mentioned Prevent Suicide PA, one of our statewide suicide prevention organizations. They do run an annual PSA contest for high school students, and it's currently open. So this is where, I don't know if anyone's ever participated or had students participate in the PSA contest. This is that opportunity for youth voice. And we heard from Avita this afternoon just how powerful that voice can be. We have an annual contest where students can create posters, videos, audio clips, and submit them to the contest. And they are all housed on the website so that any of the winners or submissions from past years can be accessed at any point in time. And I want to mention it not just because the contest is open and I think finishes in 2 weeks, so there's still a little bit of time, but also that those resources are available and a tool for you all to use at any point in time. So for example, my Zoom background, if I was at home, is one of the youth PSAs that is advertising for 988 with a message that comes from youth, right? We've had schools partner with movie theaters. I think that happened right in Lidditz, where a movie theater showed one of the winning submissions in front of every movie for a month, 1 year, right? So it's youth driven and youth led, and also can open the door to some of these partnerships and creative ways that we can be sharing and getting this information out there. So thank you.
All right, folks, at this time, we'd like to open it up to Q&A, both virtually and for the people in the room right now. We also were fortunate enough to have some questions submitted beforehand. But with that being said, are there any questions in this room for any of our service providers up here? There's a ton of resources I know that they were able to gloss over, and more that they never even mentioned, and a couple that they're not allowed to share yet, and that one that's really, really funny that I'm not allowed to talk about. Are there any questions? Yes, I'm not allowed to talk about it. Yes, I see another question in the back. Yes.
Suicide assessments and screens and I think I understood wanting to reduce the call to crisis. I understand that, right? And handle it more in-house and not have to refer to crisis.
Yeah, I think what we've seen in our county, at least, and I've talked to my counterparts across the state, is that it would just be better to build the capacity within, because you know the kids better than have it calling in crisis. Because sometimes when you call in crisis, it gets dismantled a little bit.
So I'm in Western Pennsylvania in Washington County, and our required protocol to access hospitalization is to do the assessment, call crisis, have them also do the assessment, and then have the child go to the hospital, the emergency room, endure that for 8, 10, 12, 24 hours, and then maybe get a bed if there's a bed available. That is the system that we have in Washington County. Is that not the required system?
I mean, I can speak for what we do in Montgomery. We don't do that. We have one person do the risk assessment, and then they typically call over to the hospital and, you know, make that warm handoff happen that way. To involve all those extra people, and it's exhausting, not just for the clinician in the school, but the crisis and the child and the parents. Yeah.
Yeah.
Do you have like a best practices for that? Because I've never heard of a different way than saying, unfortunately, you now need to go to crisis. Because liability wise, I don't think I, as a school counselor, want to be making that assessment. The student is or isn't in need of inpatient care. How do you go about, and who goes about making that assessment if they're not going to the emergency room?
If they're not going to the emergency room?
Or like you said, well, then we call a hospital. Like what it's cut out, I guess, of that process if it's not based on my school counselor suicide screen that you need now to go to crisis.
And crisis can be different in each place. So in Montgomery County, we have Fortune Clinic, we have Brookland. Those are inpatient hospital settings.
Okay.
And we could refer them there. They still have to do their own assessment. They will have to do their own assessment. We can circumvent that we have a partial hospitalization program, and we can get them in that way. But like typically a school, yeah, you'd still have to go to like a crisis center, like an admissions department within an inpatient facility to do that, evaluation. If you're doing a 302, they have a 72-hour hold, like that kind of stuff. But yeah.
I'm curious to hear some of Perry's feedback as well right now.
Yeah, and I guess what I would say is that every county functions differently, and every district has their own policies and protocols for how they do that. So in some places, unfortunately, there is a lot of duplication. And, I completely agree that that can be very traumatic. That can definitely really impact the outcomes of these pathways. But we also, I think, have to acknowledge that training for school mental health professionals varies widely. As a school psychologist, I got this much training in suicide prevention in graduate school. And so I think it's also acknowledging that we all have different levels of comfort with doing this work. So most schools do have within their policies and procedures a requirement to at least have methods of identification, which usually is at a minimum some kind of screen. There are schools that have much more, their counselors or school psychs or whomever have a much higher level of training in that area. And so we'll do much more comprehensive assessments. But even doing that, it doesn't negate what these other systems partners will need to do when you do make contact. So I think it really comes down to how differently it's structured in different counties. Within our current suicide prevention grant that we have at the state level, this is one of the things that we're trying to bring systems together to talk about and try to problem solve around, because of what we're hearing from youth and families about how potentially traumatic this experience is, and having to repeat the story to different people over and over and over again. But our systems don't understand each other, right? And crisis doesn't know what we've done, and we don't know what they do. And, inpatient does their own thing. And so I think that is, a big part of the problem. So I think that trying to find ways to have these cross systems communications and try to get to the bottom of it. And I think, for those of us that aren't as well trained in some of these things, we don't have to be doing comprehensive assessments, especially because these things will probably get repeated to some degree. But at a minimum, we have to have enough information to know whether we need to engage these other systems if there is some sort of higher level of risk. So one of my colleagues always says, like, the no or go decision, right? Like, do kids have to go, or can we just kind of address these things in house? So a lot of, I think, considerations there, but just knowing that, like, when there's some barriers happening at a cross systems level in counties, that would be something to kind of, to raise with the county mental health office at a minimum. Yeah.
And just to that end, if you get a chance to go back, some of these important dialogues for cross-system partnerships was addressed in Mark Durgan's presentation, which will be available for on-demand to anyone who didn't see it. As a former crisis worker, mobile crisis worker myself, working in Lebanon, but also with Lancaster and Dauphin County, the training that school counselors receive is more advanced than most mobile crisis workers. Just to note, assessing and managing suicide risk is a really great training if you ever have access to it. But I see another question in the back at this point.
I have a comment. I think this still speaks to the need to continue engagement across our mental health professionals and the systems and the networks, and the locally established norms are so different across our many hundreds of school districts and the counties. The training we all have. Karen and I, our districts are 15 minutes from each other. I'm in a different county now, and so we have a different practice. It's just intriguing, because the reality is the fact that it's so differentiated and we're not working in collaboration with one another. It's really just the kids not receiving services. And I know I'm made, but it speaks to the need to continue having these conversations with one another and to create the policy of care that needs to exist across the state with the systems of care. They need to overlap, because the reality is the system's crumbling. And we're all here trying to pick it back up, but it's just our kids that are suffering. And we can, put that video on Friday if you like.
That's good.
We love kids want to see lives, right? So, I don't know.
Great.
A lot of great professionals that have wonderful ideas and are experts. But we're all working on the side of
Other questions right now?
Just,
Thank you.
What?
I said thank you.
It was Brandy, your early childhood. So some things we've seen, and we are a very rural district where we work, but I've heard some of this across the state and the nation as well. Coming out of COVID, coming out of all of the, the things that normally children would have been accessed, what kind of tools and resources are being put in place, knowing now we are seeing maybe a rise in some developmental delays and lack of access, or they just didn't get access to early intervention they could have.
I just wanted to summarize the question for virtual participants. For in regards to early childhood, particularly when it comes to horizon and developmental delays, what tools and resources are being developed, particularly in the state of Pennsylvania to service?
Specifically school-related things that we
Related.
can do to support, knowing that need is coming and is already here.
Okay, a few things I'm thinking. I mean, much like what's happening in school districts, I know that my daughter said 5 or 6 high school teachers just left this month from her school. We're down 10% probably of the workforce, maybe more in childcare. We're also down about 7% of the number of childcare programs. So you may start seeing a lot of kids that have never had an early learning experience. So they're going to be missing some of those soft skills, some of those abilities to sit in circle time and different things like that. So definitely think about, Octel and PDE just updated a transition to kindergarten toolkit. So there's a very large resource on how school districts might really start to work with their early learning feeder programs around transition and prepping young children and families to enter, kindergarten. So there's some good things there. One resource that we use in early childhood mental health and early intervention technical assistance, it's called the pyramid model, but there's a National Center for Pyramid Model Innovations. So it is kind of a MTSS framework for young children on different ways that you can support social emotional development. And it can actually be applied up to 3rd grade. There's a lot of great resources on how to have nurturing and responsive relationships, how to have high quality environments, how to target social emotional learning in different ways through the routines. So there might be some really great resources that kindergarten, 1st, 2nd, and 3rd grade teachers can use to kind of embed into their day-to-day routines that target social emotional development and those soft skills that maybe some of those munchkins didn't get because they didn't have consistent quality childcare, or maybe families. I mean, we don't have a waiting list right now, as far as I know, for childcare subsidy. I don't know that in my 12 years at the PAIU I've ever seen no one waiting for subsidy. So kids are somewhere. They just may not be in childcare. They may be with a neighbor. Family may have stayed home or are choosing to care for them at home. So I think there's lots of opportunities maybe to partner with childcare to understand what kids are learning, but also maybe use some of the resources that we promote in those early grades to fill the gaps for those little ones.
Brittany highlighted a key point that I'd like to kick to the rest of the panel at this point. In what ways have you seen that staffing shortages, either in school entities or in behavioral health or other services? How's that impacted service delivery at this point?
I can answer from, it's impacted significantly. So I will say, like, I can say from a provider of partial hospitalization programs, we're competing with outside entities like big hospitals, and they're offering these $10,000 sign-on bonuses. And that's impacting our ability, obviously, because we don't have $10,000 to give these amazing workers. And just, psychologists are very scarce right now. We can't find school psychologists anywhere. Social workers, counselors, it's been tough. Yeah. I'm just saying from our IU perspective.
From a PDE perspective, I'd say one of the things that we're noticing is a lot of administrator turnover. So it's not just affecting the classroom, it's also affecting school leadership, as well as district level leadership. And that's when establishing these systems are so important, and documenting them in policies and procedure handbooks, and creating teams within the schools, because those provide a leadership system that can exist when there's instability at the top of the organization. So as we're talking MTSS, we're talking about using some of these tools like the SHAPE assessment to begin to do a systematic improvement efforts around student mental health. That work ultimately can be, we obviously need the support of the top, but it happens with the folks who are engaged at all levels of work with students. And so don't feel discouraged and not do it, because this might be the most important time for you to be engaged in those teams and building those systems and documenting them and creating your MTSS model, because your leaders are going to be coming in and trying to learn their way forward. And if you have structures and systems in place, you're much more likely to be able to maintain continuity of care for your students. I would just like to add to that and think about the impact COVID has had. When we talk a lot about infant mental health, we're talking about kids developing in the context of the relationships with the adults around them, right? But if our adults aren't healthy,
So how are we focused on our workforce? How are we focused on ourselves and our colleagues so that we're healthy, so that we can help kids be healthy? So in a lot of times I'll talk and I'll say a dysregulated adult cannot regulate a tantruming 2-year-old, right? Or 14-year-old, right? Or colleague. Like if we're dysregulated and we don't know how to take care, we're not getting support from our colleagues or our administration or our family or our community, it's really hard to support little kids because there's a parallel process there. And so I think, I mean, at the Pennsylvania Key, we're really focused on how are we caring for the workforce that's caring for the kids. Because if we aren't well as adults, it's really hard to help kids be well.
I think the only thing I would add is I guess the way I'm seeing it play out is like with impacting across systems, having a trickle across or trickle down, right? Because when we're short-staffed in our schools, that impacts how our teams are functioning. That impacts if we even have teams, if they can meet, who's available to deliver those prevention efforts, right? And so then we have kids that are going longer periods of time without their needs getting met. And so we're looking at the mental health service system and the crisis systems and looking at how overtaxed and overburdened they are. But it's like, we can't seem to get ahead of the issue, right? And I think a lot of what we talk about is really like trying to focus on those prevention efforts, but that's really, I think, where I see a lot of this, playing out most, and then having that cross systems impact.
I think that's mental health issues such a bigger problem than let's put a piece of candy in your mailbox and say you're doing something nice for you. I think there's just such a bigger issue with shortages and them feeling like Larissa said, don't add one more thing, make it one thing. They're so tired of saying